Hello, I'm Ellie Crisell. Welcome to South East Today. A Christmas crisis. As winter pressures begin to bite, we ask if hospitals can cope with the seasonal demand.
It is unfortunately becoming the norm, having high levels of patients in trolleys.
The plea from paramedics only to dial 999 for emergencies, with calls expected to hit 90,000 this month.
We're trying to get to people as quickly as we can. And when there are alternatives to 999, that's obviously prolonging our response time to those people that really need us.
Care in the community. Amid growing demand, we meet the teams trying to alleviate pressure on our hospitals. From the front line to the pharmacy, we'll have the latest from our team of reporters.
And we'll be answering some of your questions as to why winter ratchets up the pressure on the NHS.
Hello, good evening. We're live this evening. We're at Tunbridge Wells Hospital and we have a special programme looking at how the NHS Frontline is preparing for what many believe will be their toughest winter yet, as the onset of this cold weather and flu starts to put pressure on an already stretched service. We'll look at how hospitals, how ambulance crews, how GPs are likely to cope with that surge in demand. What might the impact on care be over the coming weeks in a period where planned strikes are also likely to cause disruption? First tonight, our health correspondent Mark Norman reports on how doctors at this trust, which this week reported one of the highest numbers of emergency patients in their history, are coping with a Christmas crisis.
This is the NHS in winter. A&E patients stacked in corridors, millions on waiting lists for operations, staff stretched, stressed, and some quitting in frustration. Nowhere is the pressure more keenly felt than in A&E. Maidstone and Tunbridge Wells Hospital's emergency department is one of the most effective in the country, but they've had to rework the way the department functions.
Because we know historically winters are going to be busy, we plan ahead. We've come to the realisation that patients don't necessarily need to be admitted to hospital to see a specialty and to have their investigations done. So the idea is they come in, they see a specialty directly, they have their investigations, then they're sent home the same day. We're coming to the understanding it's making a significant impact.
The challenge is enormous. Even before we reach the peak of winter, all hospital trusts in our region are failing to hit the NHS A&E waiting time target of seeing, treating, discharging or admitting 76% of the most urgent cases within 4 hours. To Medway, just 67.8% of the most urgent cases were completed in that 4-hour time frame. In Sussex it was lower at 60.1% and even worse in Surrey, dropping below the 60% mark. The worst performing hospital was East Kent, where fewer than half of the most urgent cases were seen, treated, admitted or discharged in 4 hours.
So we've been caring in corridors for 12 years now. I'd like to think we're quite experts at it, unfortunately, in emergency medicine. But yes, it is unfortunately becoming the norm, having high levels of patients in trolleys. And I'm talking not just 1 or 2 or 3. I'm talking up to 46 patients in trolleys and corridors in space that we call them corridors. We've got no other label for it. It's a random space which is not clinical and not appropriate to treat patients in.
Compounding the problem, the fact that almost every hospital bed in every hospital is already occupied. The need to free up beds for the sickest is a key part of winter plans. One solution, virtual hospital wards.
We will review them with a consultant tomorrow. And then
the virtual ward is an acute model, so basically we have got the technology to facilitate looking after patients in their own home that would otherwise be in a hospital setting, so in one of our acute beds. So we've got 24-hour nursing care and treatment slots available with consultant cover. I think it's 2,800 bed days is what we've been able to release back into the acute setting.
This winter, thousands of patients will be occupying hospital beds when they are medically fit for discharge. Hospitals increasingly using data to map scarce resources with patient care and staff availability. The NHS calls this care traffic control.
The challenge with winter is we often see more patients, we often see more sick patients during winter. And what this does, it just gives us that real insight into what type of patients we've got in, again, making sure we've got the right level of treatment for those patients. And then, and if we're needing to correct things or we need to bring in more treatment, it gives us that sort of live in the second minute updates of actually how we make sure we can progress patients through our system to make sure that we haven't got ambulances queuing or an A&E that's overly busy.
The final piece in the NHS winter plan is us, the health service urging the public to use 999 for emergencies, but use primary care and NHS 111 for other health conditions. Mark Norman, BBC South East Today, Maidstone.
Well, we can talk now to Dr. Lawrence Maiden, who's Chief of Medicine and Emergency Care at Maidstone and Tunbridge Wells NHS Trust. Forgive that noise in the background. It's not a siren, it's actually a car alarm, can you believe it? Dr. Maiden, you've seen some of the highest numbers of emergency patients in the hospital this week. How are you coping?
Absolutely, it's just getting busier and busier throughout the year, but especially in the winter time. And that's replicated up and down the country. But there's lots we've been doing throughout the year to try and get ready for this. Our planning started in the summertime. We've increased the number of doctors in A&E and across the wards. We have more specialists in reaching into the emergency departments. Those patients that do come to hospital, we can sometimes arrange for them to come back to hospital through our same-day emergency care centres, our ambulatory units, rather than actually being admitted into hospital. We have our virtual ward as well, where patients can be transferred from the hospital back to their own home, and we have teams in reaching into their homes to see them and to make sure that they're getting the right care.
So you have various schemes, and the name of the game is to keep people in the nicest possible way out of hospital.
Well, that's exactly right, of course. If they need to come into hospital, they do need to come into hospital. But we've found that we put a lot of initiatives into place to try and get patients back into their own homes. They'd prefer that, of course. They're more comfortable in their own homes, more familiar. So these same-day emergency care centres that we have developed across all the different divisions within the hospital have been very helpful. And the virtual ward is that new thing that we've launched just over a year ago now. But getting patients back home safely is important. That's why we work in partnership with our community hospitals and our social services to ensure that there's a seamless package of care when they're discharged.
And is the demand on the NHS increasing? I mean, we know obviously we had this huge demand during COVID, and then I think people thought perhaps as that tailed off, things would go back to normal, but it just seems to be getting worse and worse. Is that fair to say?
Absolutely, yeah, and it's replicated up and down the country, and it's not just at winter time, it's throughout the year. We're seeing more and more patients. For example, this summer we saw more patients than we did in winters in the past, so it's just getting busier. And that's just because of population growth, because of an ageing population, because of the acuity of diseases. But you're right, COVID and flu are on the rise again. We're seeing more patients who don't necessarily need to come into hospital, who can be managed at home, but there's increasing numbers of COVID patients in hospital, which is why it's important that they get their COVID and flu vaccines, of course.
Dr. Lawrence Maiden, thank you very much for joining us. We'll let you go and get warm, thank you. Next tonight, following on from that, a plea from paramedics to only ring 999 for emergency injuries or illnesses, with the South East Coast Ambulance Service expecting 90,000 calls this December. Our investigations reporter Josie Hannett has spent the day with a crew in Sussex to see the pressures they face in their job. This is her exclusive report.
It's 7 a.m. when our first call comes in. An 88-year-old woman complaining of upper back pain.
Were you advised to take aspirin at all when you telephoned 111? The advice was that we take her to hospital for some blood tests. Celeste didn't want to go to hospital. We gave her some advice that if the pain was to return, call us back.
The next was a 999 call for a 96-year-old man with breathing problems.
Let's see what we can do for you today, but we need to just do some observations first of all.
I thought you were going to put me down today.
Absolutely not. There's still plenty left in you, don't you worry.
If this is just an infection, which is what we're all suspecting at the moment, then that's perfectly treatable with antibiotics. So what we're trying to do at the moment is avoid Christopher having to have a lengthy hospital stay by taking him now, getting on top of these infections and hopefully getting him back on his legs and home as soon as possible.
We've just dropped off our first patient at East Surrey Hospital. He's going to go in for more tests and observations. Now, I wasn't allowed to film inside there, but Lee and Beth took me in whilst doing their handover. And one thing is clear, the ambulance service and that hospital is under a huge amount of pressure. There were 12 people in beds waiting to be admitted. And all the time the ambulance crews have to hand over their patients, it means fewer crews out on the roads responding to incidents.
You're pulled in, you're sat in a corridor for hours. I think it's quite scary and frustrating. We're busier, we've got a higher volume of calls to get to, which means that people are waiting longer for us. Hospitals are overrun as well, so we spend a lot of time waiting there. The more people that we take in, the busier they get.
Our third patient was a 93-year-old woman showing symptoms of a TIA, more commonly known as a mini stroke.
Are you not quite feeling yourself?
Well, no, I'm all right, and then I'm not.
The crew gave this patient a thorough look over.
Just turn your hands over for me and you just put them out as far.
But she was recommended to go to hospital for further tests.
I like the fact that you come into work, you don't know what you're going to go to that day, and every day is an opportunity just to help someone, make a difference to someone's day.
Just outline to me some of the pressures that you face in your job.
There's all sorts of pressures really, mainly just the demand on the service. So we don't expect everyone to know who to turn to, but and obviously in an emergency we will always be there. GPs are also under pressure, so quite often it results in people calling 999 for help.
35-year-old Lucas was waiting for a train at Gatwick Airport station when he collapsed and had a seizure. Back to the ambulance, and Lucas doesn't remember much of what's happened.
And when you have your seizures, how long does your recovery normally take? You just feel very sleepy for a while?
Yeah, a few hours and I'm back to normal pretty much. They make sure I'm all right, and I'm ready to fly, and gave me directions on what to do if I don't feel quite all right. So yeah, it was a really good experience as far as seizures go.
Can you straighten this arm for me? Can you straighten this arm?
It's just after 4 o'clock in the afternoon. 101-year-old Rita has fallen on a patch of water in her kitchen.
Is she allergic to any medications? You know?
You've got quite a nasty injury on your face. We need to pop you to the hospital, all right? I know that's not what you wanted to hear.
Despite some protests from the patient, she was taken to the Princess Royal Hospital in Haywards Heath. The final patient of the day was 76-year-old Esther, with a suspected broken arm after she tripped in the kitchen.
You've been able to move it at all?
Not really. After lying on the floor for a couple of hours, it was suggested that I phone for an ambulance, which I did do, and they were very helpful.
Beth, end of shift, how are we feeling?
Tired. But yeah, 5 or 6 I reckon for 12 hours is quite normal.
Some of the patients we dropped to East Surrey Hospital were still waiting in the corridors on our final drop-off 8 to 10 hours later. And back at the Gatwick Make Ready Centre, ambulances are prepped and waiting for the next shift.
Well, let's talk to Josie now. She's in Crawley at one of CCAM's centres. Hello, Josie. The Trust is forecasting very high call volumes this month, and it's already been a very busy few days, hasn't it?
Exactly, Elliot, and that surge in demand has already begun. CCAM well on the way to reaching 90,000 calls in December. Now this is Gatwick's Make Ready Centre. You can see behind me a table of stock which will go into the ambulances that are quite literally, clues in the name, being made ready for the next shift. Now I wanted to give you an update on some of the patients that you saw in my report there. 35-year-old Lucas, who had the seizure at Gatwick Airport. He made his flight, he is back from his holiday and he had a great time. 101-year-old Rita, who fell at home. She's still in hospital but hopefully on the way to recovery. And Christopher, the 96-year-old man, he is being discharged on Friday. So great news for him in time for Christmas. A key message from CCAM this Christmas to please treat staff with respect. Abuse still happens, and because it's Christmas, be extra nice to staff who care for you.
Josie, thank you very much, and please do continue to share your experiences of the NHS with us. We love to hear from you. You can email us, southeasttoday@bbc.co.uk, or send us a message on any of the social media platforms, and go and have a look at our special live page that's giving insights from patients and staff on the front line. You can find that on our website. Let's speak now to Mark Norman, our health correspondent. He is here at the hospital, but he's over at the A&E department at the other side there. Mark, can you tell us how busy has it been there today?
Well, Ellie, I don't think there is any such thing as a quiet day in the NHS, but it was certainly quieter. I've just come out of A&E. There's maybe 20 or 30 people waiting in there, a triage nurse at the front door, making sure everyone gets where they need to be. I think one of the things we've seen today is that the busier the NHS gets, the more its performance drops, and they struggle to hit all those government targets that we're always talking about. I think it's remarkable to think 200,000 of us attended A&E in the month of October. 700,000 people in Kent, Sussex and Surrey are currently waiting for an operation with the NHS, and GPs had 2 million appointments in October, the first time that's happened. Now, when we talk to the government, they insist that what they're doing is easing pressure on the NHS this winter.
We're not taking anything for granted, but we are seeing ambulance response times improve. They're 20 minutes quicker on average for a Cat 2 compared to last year. And also the turnaround times in A&E are faster as well. So the resources we're putting in, both finance, people and infrastructure, at the moment are getting us through the early stages of winter.
Look, the reality is, I think there are no more resources coming to the NHS. There aren't a whole bunch of doctors, new hospitals coming over the hill. They're having to work with what they've got this winter. Everyone is pulling together, trying to make the best of what they've got, but they also need us to play our part. They need us to use services wisely, because as we've seen with Josie's piece and with what we're seeing in hospitals, the pressure is enormous and it's only going to get worse.
Thank you, Mark. Well, the way in which that care is being delivered, as you say, is changing, with the NHS making greater use of the skills and expertise, experience of community nurses, GPs and pharmacists to reduce hospital admissions and provide the most appropriate treatment. Charlie Rose has been hearing from 3 different people meeting our healthcare needs as we prepare for winter.
So this was our call hub, and in here we've got all the team currently taking all the calls that are coming through.
Dr. Pratichi Malik shows me around the revamped St Mary's Island surgery in Chatham, where it seems much has changed for the better.
It was non-stop. The phone lines, there was generally 40, 50, 60 people in the queue all day long. That has drastically reduced till now. We don't very often have more than a 10-minute queue.
It's all thanks to a new streamlined system helping patients access a wide range of primary care services, easing pressure here and on other parts of the NHS.
Prescriptions was a big issue, discussing test results, booking appointments that we're sending reminders to. So good patients who've been told, please book your flu jab, please book your smear. It's mad for them to ring the surgery, wait, number 10 or 20 in the call to book the appointment I've told them to book. So we've introduced self-booking. So we just send them a message and they can book it online automatically with that dedicated link.
Hiya, David.
Who is it?
It's Manglish, one of the nurses.
David Stanton is blind. He's one of a number of patients in the Crawley area who are seen at home.
I don't like being in hospital. I'm all right while I'm initially there, but I got bored. It was stiff because I can't get around.
Absolutely thrilled of doing these kind of jobs, and our nurses are looking after patients like that in their own environment, and less hassle to the acute hospital or community hospitals out there.
And a service that's helping to make things a little easier for GP practices is this pharmacy in Hempstead.
There are things in the horizon where pharmacists will be able to supply certain medicines for particular conditions, medical conditions, which would normally require a GP to issue the prescription for. But this is something which a lot of pharmacists are now looking forward to dealing with in the new year, under training and under further guidance.
Today there was a steady stream of people coming to collect their medicines. One of many chemists across the southeast bracing themselves for a busy winter period. Charlie Rose, BBC South East Today.
Well, Chrissy Reedy is live for us now at a pharmacy in Hempstead. Chrissy, it seems like a lot more is being asked of pharmacists in supporting the NHS.
Absolutely. I think for many people, the pharmacist and pharmacy team is the first port of call. And what's really interesting here today, you can see the demand for information from the pharmacist is much greater. Of course, it's free advice, it's over the counter, and there's no appointment required. Here today, there's been a constant flow of people, sometimes 5 or 6 people waiting at a time, and I'm told that is quiet. The pharmacist is still very busy at it this evening. This is probably one of the smaller pharmacies in Medway, but definitely one of the busiest.
Thank you, Chrissy. Well, we know we've been talking about this whole programme is about how the NHS is facing yet another difficult winter period. Staff facing similar pressures each year with ambulances queuing outside hospitals, people waiting in A&E or having routine operations pushed back. But why is this? And how does the performance of our health service compare to health services in other countries? Piers Hopkirk has been finding out.
Now, to answer that, it's important to look at the performance of A&E departments because they're seen as a kind of stress marker for the whole of the system. Now, back in 2016, the House of Commons Health Committee launched an inquiry into why winter presents so many problems. What it found was that actually the peak for visits to A&E came in the summer, but during the winter, patients were much more likely to be sicker and to be admitted to hospital. And it's this that causes the problems. Now, winter pressures are factored into the system, but it's a system on the brink and there's not much by way of resilience.
Over the last decade and particularly over the last few years, it's seen some extra pressure because of long-term issues with staffing and more recently because of industrial action, because of rising levels of flu and COVID, are all putting extra layers of pressure on the NHS.
Data alone can't give us a definitive answer, but historically, winter's always been a challenging time for the health service.
The managers of the National Health Service have called for a thorough review of the way the NHS is funded, but they say the government must give them more money in the meantime. Otherwise, they'll have to hack and slash at services.
With hospitals all around the country struggling to cope with thousands of extra cases of flu, the Health Secretary Frank Dobson has been explaining where extra money given to the NHS for winter problems has been spent. But opposition MPs say more money is needed to ease the pressure.
During the 1970s, there was industrial action. In the late 80s, a period of huge economic strain. And in the 90s and noughties, bronchial infections became a regular winter feature alongside a system that was struggling to cope. But what we're seeing right now is a combination of all three. COVID on top of other winter infections, ongoing strike action and a period of huge economic uncertainty. Rarely, if ever, has the NHS faced such a multitude of challenges. Now, it's difficult to draw direct comparisons with other countries, but the sorts of problems faced by our NHS are faced in other parts of the world too. So if you look at Ireland, they've had a recruitment freeze there because of financial pressure. There's also been concerns over hospital overcrowding. And in France, in January, the healthcare system there was pushed to the brink by a variety of factors. So it's clear we're not alone. But there's no doubt that if you look at our NHS and the pressures it's facing, that it stands at a critical point in its history.
Piers Hopkirk reporting. Well, let's get a final word from our resident expert, our health correspondent, Mark Norman. Now, obviously, the NHS is under massive pressure at this time of year, but exacerbated by these upcoming strikes. How's that going to affect things?
I think this winter will be made worse because of the strikes we've already had. We've got 3 days of strikes in December, but particularly the 6 days of strikes in January are going to be extremely difficult, straight after Christmas, New Year. Social care won't be working properly. Hospitals are really going to struggle with that, people coming back on shift. I think we, the public, have got to be a lot more realistic about what we get from the NHS. Ambulances, doctors, hospital beds, they're not all lying there waiting for us to, rock up and use. We have to think about how we use it very carefully, use it sensibly. You heard in Josie's piece, ambulance service under enormous pressure, same with GPs, same with hospitals. Unless we do that, the system is going to buckle and it's going to really struggle to cope at all at any point of the year, winter or summer.
And it's getting worse and worse.
I think it is.
Seemingly.
It's absolutely struggling even more so. Since we've been here, 5 or 6 ambulances have arrived at A&E. That's 5 or 6 patients needing beds, doctors. They may need beds in hospitals. That's getting busier all the time.
That is it from me at Tunbridge Wells Hospital with our special programme. You can see much more online and on our social media pages. And Charlie Rose is back with your late news update. From me, though, and from Mark Norman. Bye-bye.